You're listening to The Bird Bath. This episode of The Bird Bath is brought to you by Pearl AI. Pearl AI is an affordable, always-on AI veterinary solution that combines AI with a team of real, licensed U.S. veterinarians. Get the best of both worlds, the speed of AI and the accuracy of human professionals. With Pearl AI, your clinic can offer real-time 24/7 coverage without hiring extra staff. It also automates screening and triage, lowers your operating costs, and turns more of your site visitors into paying clients. Integrate Pearl through a simple web snippet or API and start growing your practice while you sleep. Learn more at pearl.com/thebirdbath. That's pearl.com/thebirdbath. Welcome back to The Bird Bath. Each week we scrape the surface of the news you need to know, so let's get into it. Kicking us off this week is a big story from a company that I know rather well, Digitail. Digitail has some big funding news, and instead of going at it and giving you the rundown on my own, I thought we'd bring in a guest. So we're very lucky to be joined by co-founder and CEO of Digitail, Sebastian Gabor. Sebastian, thanks for joining the show.
Hey Ryan, thanks for having me. It's great to be here. And today, I'm really excited to share that Digitail just raised $23 million in funding led by 5M's Capital, with the goal of helping more veterinarians simplify their workflows, see more patients, and make it home on time.
Now, Sebastian, that is awesome. $23 million for a Series B round is a huge, huge amount, and something that we've seen a lot of really cool companies starting to raise rounds about that similar size over the past few months here. How are you planning to grow what Digitail is doing in this absolutely AI crazy market?
So we're taking things a step further with what we call holistic AI, which is a team of AI agents that work together for you and are meant to support each role in the clinic. This means hospitals using Digitail can start using 3 new agents: Tails Concierge, Tails Medical, and Tails Practice Manager, to provide a unified experience that brings together dozens of AI workflows that we've developed over the past 4 years, so clinics can delegate and stop doing the tasks they don't get satisfaction from and deliver truly proactive and continuous care. Throughout all of this growth, what I'm most proud of is that Digitail remains independent. In a space that's seeing a lot of consolidation, we're doubling down on innovation and on serving the thousands of clinics that drive this profession forward. If you're curious to learn more, we're easy to find at digitail.com. I'm always happy to chat.
Sebastian, thank you again for joining us. It is always a pleasure to take a little trip down memory lane with you and jump into some of these stories. I look forward to seeing what Digitail does in the future. Now, as we dug a little bit deeper into the story after talking with Sebastian, we learned a little bit more about 5M's Capital, who led the round. They're new to VetMed, but they've previously exited another investment in the med spa practice management software space. So it's going to be neat to see how they take that experience and advise and grow alongside Digitail. Previous investors, Atomico, ByFounder, Partech, Gradient, and others also participated in follow-on investments in this round. Cencora, the parent company of MWI, had a very big and interesting Q4 investor call. It was a generally positive investor call, but the big thing that stuck out to me was the conversation around their vision or structural differences of where they see the MWI business and that portion of their portfolio growing. Cencora's CEO, Robert Mouch, said in the review of the business, well, first off, he said a lot of great things. He said that they're going to be investing $1 billion over the next 5 years in growing the infrastructure of Cencora, which a lot of you still might think of as AmerisourceBergen, but they changed the name and the colors and all of that. But the thing that really, really stuck out to me was what they said about MWI. In the investor call, the CEO said, "We regularly evaluate our portfolio to ensure we are focusing on areas that advance our long-term vision. As announced this morning, we undertook a thorough review of our portfolio as part of our approach to prioritize growth-oriented investments. This review led us to sharpen our focus for the business, including in both our U.S. and international healthcare solutions segments." Here's the part that matters to you. "We identified specific areas of the business that do not align as closely with our strategy going forward. specifically our animal health business, MWI. He went on to list a couple of the other businesses that they have in that space, and he said, as a result, we are evaluating strategic alternatives for these businesses and are grouping them as other in our financial reporting to provide additional transparency for our investors. So what that means for people that are thinking about this is Cencora, the parent company of MWI, has taken that along with some other businesses that they don't see closely aligning with their strategic focus and setting them aside and sort of separating them from their traditional financial reporting as a way to make a more clear path of where the company wants to be going forward. What does that mean for MWI? It could mean a few things. It could mean being spun off into their own business, like we saw with the creation of Elanco from Eli Lilly. We could see the sale of MWI to a new business. We could see MWI going private through a private equity investor. We could see a takeover of MWI by somebody like Patterson, perhaps, with Patient Square Capital behind them. No idea exactly. All of these are, speculation, but they're things to think about when you're thinking about where the future of the business goes. And it's interesting to see such a large company like Cencora setting aside their animal health business and focusing on their human and specialty businesses. Medivet has unveiled a plan that can't be deemed a coincidence. Medivet made a very interesting announcement this last week that by 2027, they plan to have all of their UK practices co-owned. The business plans to do what it describes as having partners in the business by 2027. Their UK chief executive, Ben Jacklin, who recently joined them from CBS Group, said, "We've listened closely to our partners and their feedback has been clear and constructive. They love the clinical autonomy they've always had, but want greater operational autonomy to lead their practices. They want less bureaucracy and more access to a network of leading veterinary business expertise. That's exactly what we'll deliver. We're putting ownership and accountability firmly where it belongs, with the people delivering exceptional care every day." So Medivet is bringing a new generation of practice owners into the fray and as partners in the Medivet locations across the UK. So when you look at this, it can't be considered a coincidence when you see what's happening. Massive things are happening in the UK market, with the CMA continuing their investigation into prices at vet practices across the countries. And the groups are taking steps to show the regulators that they're addressing these concerns before the final verdict comes out in March. Companies like Medivet are doing these decisions, in my opinion, to be able to show, hey, we're bringing vets back into it. We're removing the layer from medicine to the corporate groups and allowing veterinarians to be more forefront in the way that medicine's practiced in vet clinics. So will this make a difference for the way the CMA sees it? We'll know more in March, but kudos to Medivet for putting veterinarians back in the driver's seat. Is it too early to start talking about Christmas? Not at my house, because we started talking about Halloween in the middle of the summer, and the day that the costumes were put up, Christmas came out. So if you're thinking about Christmas, you could be thinking about a little known guy called Chewy Claus. Chewy has announced that they're going to be donating up to 16 million meals to shelter pets and $10 million through their annual giving program. From now through December 24th, pet owners can submit their holiday wish list. Chewy Claus will deliver 5 meals to a pet in need through the partnership with Greater Good Charities, and they'll deliver up to 16 million total meals to charities. Wishes submitted through the Chewy app will also generate an additional 5 meals. Pet owners can also choose to defer receiving a gift for themselves and redirect an additional 5 meals to shelter animals. Chewy Claus has committed to donating $10 million to shelters and rescue animals throughout the United States, also in the form of toys, gears, treats, and meals. It's something that they've been doing since 2022, so if you want to see some of those funds reallocated and pushed towards shelters, be sure to jump on chewy.com/Chewy Claus between now and December 24th, and you can get those wishes fulfilled by that big bearded guy. Our final story this week is a new study in Frontiers in Veterinary Science. They took a hard look at how Americans perceive access to veterinary care. It's something that kind of makes sense when we talk about just last week, there was a study from Secret Shoppers about how people in the US are accessing care. But this was one that was more of a perception. So on paper in the study, it sounded pretty good. More than 3/4 of pet owners say that care is accessible. But when you dig a little bit deeper, the cracks start to show. Half of respondents say they distrust their veterinarians, and over a third say they've skipped care altogether to pay for other expenses. So today, I want to put that research side by side with the Secret Shopper results from last week. It'll let us sort of understand a little bit more of how access lines up with what actually happens when people pick up the phone and call the clinic. So the new study here surveyed over 1,000 pet owners. 78% say veterinarians are available when they need them, and 77% say communication is easy. But here's the kicker. Only about 40% strongly agree that care is truly easy to access in their area. So plenty of people think clinics exist, but that doesn't mean that they can get in. In other words, it's like saying there's a grocery store on every corner, but they're all Erewhons and there's no parking. Here's where things started to get a little icky. The study found that 54.7% of respondents distrust their veterinarians. The Secret Shoppers heard a lot of talk about cancellation fees, prepayments, no estimates until the doctor sees their pet. And in the study, they call that barrier language. But the clients really just see it as a cold approach. People are satisfied with the care, but they're not satisfied with the experience. The research found that 2/3 of respondents think vet techs or mid-tier professionals could provide care equal to a veterinarian, and most say they'd rather see a technician than skip care. That's huge. So that's saying that people that were asked say that they're open to this idea of a PA or a veterinary PA or a mid-level practitioner role. But what we didn't hear in the Secret Shopper survey was that anyone asked if that was something that was there. So what it means is there's people that perhaps are open to seeing it, doing more technician's appointment, or when the PA, VPA role comes into play, that they're looking to do that. But people aren't talking about that as an opportunity in the clinics. So ultimately, the recent study says that people believe care is accessible, but the Secret Shoppers say that the access feels broken. Both of those things can be true, right? So the bottleneck isn't the infrastructure, perhaps it's the interactions that are happening. Clinics want to close that trust gap. It's not just about having more doctors, it's about how you're managing those conversations when people call to get that care. So a little bit deeper dive than what we normally do, but it's one that I think is pretty important as we look at things. I'm going to be sure to include links to a lot of these different studies we've talked about, as well as to Chewy Claus's wish list letter writing tool, and so that you guys can take advantage of all of those different things. And make sure to check out our Substack. We just published a list of all of the conferences that are happening across the globe. There's over 90 of them over the next year, so it's definitely something that you're going to want to check out. This episode of The Bird Bath is brought to you by Pearl AI. Pearl AI is an affordable, always-on AI veterinary solution that combines AI with a team of real, licensed U.S. veterinarians. Get the best of both worlds, the speed of AI and the accuracy of human professionals. With Pearl AI, your clinic can offer real-time 24/7 coverage without hiring extra staff. It also automates screening and triage, lowers your operating costs, and turns more of your site visitors into paying clients. Integrate Pearl through a simple web snippet or API and start growing your practice while you sleep. Learn more at pearl.com/thebirdbath. That's pearl.com/thebirdbath. And for more on these and other stories, join us by subscribing to our Substack. There's a link in the bio. And don't miss out on any episodes by subscribing and rating the show. For The Bird Bath, I'm Ryan Leach. See you next week.